All right, hello everyone. Today I'm with the wonderful Concepcion. And please, Concepcion, I mean, I know you wrote a couple chapters for the books, for two of the different books that we have. So, would you like to introduce yourself? What do you do as an educator? And also the co-authors that you have written the chapter.
Yes, thank you so much for the invitation, first of all. And I'm so proud and privileged to be able to talk to you today and to have two chapters in both of your books. So I'm super excited to be here. My name is Concepción Moncada Cummings. I am a descendant of Mexican immigrant parents. And currently, I am an educator at as a TA, like more of a teacher's assistant in a grad school program because I'm studying for my PhD in special education with a special concentration in emergent bilingual students or multilingual students. So currently I'm in Florida at the University of Florida, and I'm doing really great things with adult learners. Previously, I have taught our little learners K through 8, specifically in reading disabilities or reading difficulties. So my chapters are Hispanic Perspectives on Student Support and Community Empowerment and Hispanic Scholar Perspectives on Education and Wellbeing. And so our two chapters, the first chapter is the Hispanic Perspectives on Student Support and Community Empowerment. My co-authors are Norma Gomez Fuentes and Vivian Gonzalez, Dr. Vivian Gonzalez. The second chapter, Hispanic Scholar Perspectives on Education and Wellbeing, are also Norma and Arturo Valadez Sainz.
All right, awesome. Thank you so much for that. Let me go with the next question. And both chapters they address dyslexia for multilingual students, bilingual students. Let me ask you, what inspired you to write about the specific chapters and try to have a work for those students in particular?
So when I started as an educator, I started in a kindergarten bilingual classroom. So I was teaching about 80% of the day in Spanish and 20% in English. So that equated to about reading, science, social studies, all in Spanish, and then math in English. And so what happened when I started noticing towards the end of the kindergarten years, year after year, when I was teaching, I always had two to three students that wouldn't quite leave my classroom reading. And I wasn't understanding why, because I was in a master's program where we were learning all the science behind reading. So the first year that I actually got into like the practicum portion of my master's degree, I implemented the science of reading and systematic and explicit instruction. And at the end of that year, miraculously, everybody left my classroom reading. And so I was like, huh, that's interesting. I wonder what that is. So once I started digging more, I was very curious because I really didn't want to leave any of my children without that basis, right?
Right.
Once I figured out that kindergarten was like the year to really get them prepared, kindergarten and first grade are the most important years for fostering like that basic line of reading. I was like, let me figure out what's going on. So I started studying more and reading up more. A few of my friends that I had gone to the master's with, they went into dyslexia, and I was like, what is this dyslexia thing that they're doing? And so I started reading up on that, and I eventually got recruited to go into dyslexia. And lo and behold, those students eventually, I kept up with them, and some of those students eventually got diagnosed with dyslexia.
Wow.
So that's where my passion kind of arise because it was like, well, we were, even if we do everything really, really, really well in the classroom, which doesn't happen 100% of the time, right? You're still going to have some students that are struggling because you don't have certain elements that they need, the explicitness, the repetitiveness, things like that. So that's why when it was time to write the chapters, I was very inspired by my students. I'm always inspired by my little students that are going through school that are not feeling super adequate in the classroom. I remember their faces when they felt very let down because they couldn't do anything, but really it was we needed to support them. So
Right.
that's what really encouraged me to write the chapters.
And it's impressive the way that you broke it down. I personally knew about dyslexia, kind of like what you said when you started it, but I never knew like the research behind it. I didn't know how to support those students, and unfortunately for me, and unfortunately for my students that I probably had in the past, maybe I was never able to actually help them because I didn't know how to recognize that. In my case, I taught high school. So high school is a little bit different because sometimes the emerging bilinguals or multilingual students they come to this country and at a teenager age. So those foundations that they should have from the beginning, they never probably had it. Which for me, I mean, it was heartbreaking to see that I was not able to help them out.
Mhm.
And I love also the fact how in one of the chapters you mention how the internal factors affecting the emotional well-being. As a father now, I see that for example, my son, the oldest, is struggling a little bit with math right now. So he sees how the fear to fail is there, which now is leading a little bit to frustration. But it is amazing how that can is it it can be expanded to every single student, especially for those multilingual, bilingual students. Let me ask you something, Concepcion. From your research, from your experience working with those students, what are some of the misconceptions about multilingual students that sometimes are not even seeing they are not seeing dyslexia?
Yeah. So some of the most difficult areas for multilingual students with dyslexia is the diagnosis part, because a lot of the time, be it, and I'm really glad that you brought up our MLLs that are in high school and that may be newcomers or have come after elementary school, because that's such an important part too. But it could be very early on. They were born here. They're multilingual students in the kindergarten level, and it could be later on in middle school, high school. I've heard the same things. What I've heard is, oh, they still need language. They don't have the language. And so that's one of the biggest misconceptions that I want to kind of address is sometimes it's language, but we need to put in the work to figure out, is it language? Is it transference of language? Or is it really a difficulty beyond the transference of language? And that acquisition phase of the literacy that happens naturally, right? Where you're going from one language to another and it takes a little while to kind of acquire the literacy. Is it really that acquisition phase, or is it really at this point, we need to look at, does the student have a disability like dyslexia?
Right.
Um, a disability that needs more, that needs explicit, systematic instruction, needs more repetition. And so in elementary school, whenever I was in school, that would come, unfortunately, around third grade. That's when they would really seriously start considering it. I think now it's getting better. And so I've seen people at first and second grade
Mhm.
really take it more seriously, which is great. We really can diagnose in kindergarten, and even for our MLL students, because typically, if they're in kindergarten here, they would have had a couple of years of listening to music here, watching TV in English, different things that they've acquired the language through. So, really, it's looking at that student individually, and even your middle school and high school student. How long have they been here? Have they had adequate instruction the previous full year? If they have had adequate instruction, then start looking at those minute details of where
Right.
they're at, and is that is it time for testing?
Mm, you're right. Let me ask you also, in your experience, especially knowing our demographics and the population that we have, sometimes even me as a father now, we might be not aware, or in my case, not specifically educated in that topic. Have you seen a little bit of the no, no maybe the pushback from parents? Like in my case, I remember when I was teaching some of the multilingual students, they were like, "Well, yeah, but he doesn't, él no estudia, no estudia." Like, But is it because that the student doesn't study, or is it because the student doesn't understand, and because he or she doesn't understand, create a frustration and the pushback of trying to learn? So have you seen maybe some of the parents or even the communities actually trying to understand and how we can support them with the dyslexia?
Absolutely. I had a lot of that in kindergarten, and a lot of my parents were newly immigrated. They had been under 5 years that they had been in the country from other Hispanic origins, right? And so it makes me laugh because it's so prevalent in our community, and I'm so glad that you brought it up because we are looking at Hispanic perspectives. But the whole idea es que es burro,
I
¿qué
know.
quiere,
Yeah.
maestra?
Yo le
And so
digo todos los días. I tell them every single day, like, yeah, but are we telling the right things?
yes. Ay, maestra, es que se quiere ir para afuera. He just wants to go play outside all day. And I'm like, well, is he avoiding the work? Like, are we supporting him how or her how they need to be supported? Maybe they're avoiding the work. They do that in the classroom, and this is how I redirect. And so I was very, very fortunate that a lot of my parents in kindergarten, first grade, when I taught in those grades, because I also did dyslexia teaching all the way up to eighth. And so it was hit and miss with certain parents, but definitely in when I'm remembering my kinder and first grade years, the moms were stay-at-home moms, and so they picked up their children every day. So
Hmm.
every day I was able to have a conversation. Juanito did amazing today. Maria did great today. They did this and they did that. Keep encouraging them.
Right.
Or, we need to work on this. So I gave them very concrete and specific examples of what they were doing well in and what they were lacking in, because that way I step back from they just can't do it,
Right.
or son burros, or they don't want to try. Um,
Hmm.
and even like when I had a student that his coping mechanism was to go to sleep in class when I gave him a full sheet of paper, he would do great if we were doing sounds, if we were doing syllabus, if we were doing words, if we were doing sentences even.
Hmm.
I showed him a full sheet of paper with writing, immediately went to sleep. And so what I did is I went beyond that, and I did home visits with his parents, and I really dug deep, and I was like, I wonder what's going on. So I fostered a really close relationship with families, so that I could really dig into the minute details, and it ended up he had dyslexia. So it was something that was triggering him. So what I did is I gave him a white piece of paper to cover the rest of the page,
Right.
just move down, because that's an accommodation that's super easy and we can really do. And that's something and that I told the parents that they could do at home too. And so just those kind of things that are so, you would think that they're not huge things,
Hmm.
such as giving a white piece of paper to cover the rest of the page, and that being a great accommodation at home, so that the parents can see a different side of
Right.
their but there's certain things that are easy to do, and of course, there's things that are really, really hard to do. And so I try to foster a closer relationship with them, and then just try to educate the parents, because I'm going to give you another example of kind of Hispanic perspectives. I had a parent that when we went into a 504 meeting, um, they asked me in because it was a parent that had just arrived to the country, so they really had no English skills, and they wanted to make sure that that parent, that father, understood what was going on.
Hmm.
And so I went in as an interpreter, but also as a dyslexia expert to kind of answer any of the questions he had. So when we were explaining, we were telling him what was going on and how the reading was affected and how we would be pulling him for services and all of that. And I said, do you have any questions? I really, really want to make sure that you understand everything fully. He goes, um, Maestra, lo tengo que llevar al hospital. Do I have to take him to the hospital? And I was like, no, 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 señor. Like, this is not a health issue to where it's an emergency. This is. So even those things, it's like, you don't know what they don't know, and you don't know in what direction like su pensamiento los va a
Right.
llevar. And so you start to really dig down, and I think partnering and just really allowing them to have a voice. I think that's one thing that sometimes is difficult is making sure that the parents have a voice, just as the children have a voice, and fostering good communication so that we can clear up any of those misconceptions.
And you mentioned something huge in here that maybe us and as educators we don't do it too often as far as partnering up with the communities. And I
Mhm.
believe that's huge. I mean, you even went to their houses, you even went, have those meetings with them. What is something that you encourage parents, if I may, hopefully, or maybe there are parents listening to this, maybe that one parent that would like to maybe read about the chapter and trying to learn about the how do they can help their children with dyslexia. What is something that you would encourage parents when they're finding themselves that they don't know what to do with their children? What would that be?
I would say their first recourse is always partnering up with their school. So there's several ways that they could go about it. Some teachers have more time than the others. In middle school and high school, you have 120 students or above. So sometimes time is very limited. But being intentional about reaching out to their teacher and saying, hey, how can I help? Or I'm noticing that Marcel is not doing great in this subject. How can I help him excel in that? I'm noticing some difficulties with math that I'm not really sure how to help him.
Hmm.
What do you recommend me to look up on YouTube to help them? Because there's so many things on YouTube now that we can use as parents to really help our students, but sometimes we don't know what to search.
Right.
And so just reaching out to the teacher. After that, also reaching out to the specialist at your campus. First of all, your counselor. Hey, I'm noticing, speaking of emotional well-being, if you have a student, especially twice exceptional students, those students that are really, really smart, are gifted, but also have a difficulty in something, specific learning disability or dyslexia, those students are very hyper aware that they're having a problem, and it eventually leads to depression, anxiety, and things like that. And so making sure before we get to that point, making sure that we reach out to our counselors on campus and saying, hey, we're having a really hard time in this class. I want to make sure that my student is doing okay. Can you please pull them from class and just check on them? And I want to hear your professional opinion because these are the professionals on campus, right?
Hmm.
And then also working if their student is diagnosed with dyslexia, working with the therapist. A lot of the times now, schools are getting dyslexia therapists on campus, which is
Hmm.
amazing. And so partnering up with your dyslexia therapist on campus and talking to them, and making sure that you're reinforcing or you're doing the best you can as a parent at home. Um, and so any of those things, and I think all of those things would be best if you have the time and you're able to, even if it's just emails, if you don't have, let's say you're working a lot and during the day and you don't really have time to go to the school, just send some emails and make sure that you have that open communication with the professionals on campus. And then also the number one thing that I always tell parents is realize you're the expert in your child.
Hmm.
The people on campus are the experts in that content.
Right.
You, as the parent, are the expert in that child. So if you're noticing something, do not hesitate to continue advocating for your child. Do
Right.
not hesitate to bring up the things that you're hearing or seeing at home, because the more that the parents know about your child through you, then the better they're able to target their instruction or their help in therapy or their help in dyslexia at school. So just taking up that cloak of like, yes, I am the expert and I am the expert in my child, and I will continue to advocate and just speak about my child. It doesn't have to be um, you know, uh, charge kind
Right.
of advocacy. It can just be, I've noticed that Angelo is doing this at home, and I'm wondering what this is about. And if they don't address it, just coming back next week and sending a follow-up email and saying, hey, I sent this email a week ago. Is there anything that I should be doing, or can someone please follow up with me?
Absolutely. And I mean, you just brought me back to pretty much all the conversations that I'm having with the school counselor for my oldest child. He's in second grade right now. And first of all, shout out to all the counselors. But again, it's just the amount of work she's actually put in to support my son because, he's still having that. He's struggling a little bit of math. So, I mean, he's just trying to help him and making sure that he can succeed. So that's amazing. And Concepcion, let me finish up with one of the questions. Um, you partnered up with amazing co-authors and talk about dyslexia and how we can understand the multilingual students. What is something that you want educators, policymakers to get out of your chapters?
So, for educators first, I want to tell them that it's not as mysterious as we think it is. I know when I was in the classroom, I really thought like, what is this? What are they doing over there? And now I think this has been a quite a few years, but now I think it's more information is out there, so educators know a lot more about it, and I'm hoping they do. But some states haven't quite caught up on the dyslexia train and haven't quite train their teachers on dyslexia. So just first of all, it's not as mysterious as you think. It's actually a really great thing to have in your toolbox of like um, tools that you can use with your students if you think about how dyslexic students need certain supports and certain things. And it's supports that you can use across the board in your classroom, like
Hmm.
systematic and explicit instruction, like repetition, things like that. So going out and seeking information, there's several podcasts, there's several YouTube videos now, there's several TikToks. There's a lot about dyslexia out there. So educators, if you're interested in learning more, if you think it'll help your classroom, and I know it will, go ahead and look out for that information. And then for policymakers, it's just being able to foster that relationship with educators and with the community, because dyslexia is such an important part of our community right now. Across the country. We're having so many different policies that are being created in different states. And so being able to partner with the community and hear from the community the importance that dyslexia is having in their schools. Dyslexia, being able to identify dyslexia in your school is like becoming aware of a problem.
Right.
Being able to target that problem, we need certain policies in place. And so when we diagnose, is having that support from our policymakers, and the policymakers listening to the constituents on the importance of what dyslexia is. If you think about it, 1 in 5 people are diagnosed with dyslexia. And so, or are dyslexic and not diagnosed because we previously didn't diagnose as much. And so if we're thinking about 1 in 5 people, that's a lot of
That's
your
a lot. Yeah.
constituents. That's a lot of adults. That's a lot of teenagers. That's a lot of children. It's not just housed in one area, right? And so across our communities, and especially important because we're talking on the Hispanic perspectives, is for our Hispanic constituents, people to speak up and start speaking out and telling the policymakers how important it is to have that support at school. And so just being able for our policymakers to understand, hopefully a little more through our book chapters, what dyslexia is, how
Mhm.
it affects our communities, and how it affects not only the academic well-being, but the social emotional well-being of our students.
So, Concepcion, thank you so much for the time that you have provided us. Thank you so much for even teaching me a lot about this. I learned so much about you, about the chapter, about your work, about your passion. So, I really appreciate that. So, any final words?
No, just keep fighting the good fight, and our students are very much worth it. I keep them in. the back of my mind in everything I do, as I'm going through grad school and looking at the research and writing these chapters, and just knowing that our students are worth it and we are worth it.
Absolutely. So, Concepción, muchas gracias. Thank you so much. That's it. Thank you.